Thank you so much, Mr. Chairman. And let me just start out by thanking Ms. Young for her very compelling testimony. Let me just say that small businesses account for 46% of private sector jobs, and they account for over half of all new jobs in any given year. And as a matter of fact, between 2023 and 2024, 89% of all new jobs were created by small businesses. So small businesses have an outsized impact on the United States gross domestic product. And though my colleagues, Republicans, have tried to destroy and undermine the ACA since its inception, not only would it impede health care, but it would be a draconian blow to our economy. So I just want to thank you for being here. You know, we've heard all kinds of reasons and excuses and blame shifted on whose fault it is that healthcare premiums are so high. You know, some just quite frankly say, oh, it's because of Obamacare. It's the 20 million people, job creators, that have caused the problem. We've heard that it was bad actors, higher utilization, intensity of care. I was listening. Bureaucratic red tape, medical devices, pharmaceutical companies, and of course, the villainous triplets, waste, fraud, and abuse. But I was about to just scream hallelujah and do the holy dance around here when I heard Chairman Smith ask all of you all if whether or not you engaged in this sort of vertical integration of services, like owning PBMs and surgical clinics and banks that finance healthcare systems. And so I'm wondering, just very quick, if any of you think, I know this is a sacred cow, perhaps, but do you think that that contributes at all to the higher costs, the vertical integration? Yes or no? Quick. Nobody wants to answer, okay. How about the profits that the health insurance companies get? Does that, you know, none of you really talk much about how that may contribute. And of course, CEO compensation. Nobody wants to answer that, okay, no problem. What about, I heard you say, particularly you, Ms. Boudreaux, say that competition would help lower the cost curve. So I'm wondering if you support the notion of, say, a public option, where we'd have some bureaucrat making, say, $250,000 a year, you know, 1% of the $25 million you guys make. Do you think that competition and like generic drugs, that would reduce the cost curve at all?
Well, thank you for the question. No, I don't support a public option because we haven't seen where it exists lower premiums and the actual impact of
You don't think that a public option would provide the competition? You said that all of you all are in competition. You don't think the public option would be a competition for your companies?
So we support competition, but a public option in the states where we
it would be a competition for you. Let me just ask you this: how about transparency? You know, an MRI might cost $1,500. You know, at 10 a.m. and at 4 p.m. somebody else walks in and their MRI would cost $2,500. Do you think that the lack of transparency has any contribution to rising costs? We don't know what the value and cost is of medical products.
We support transparency, and for that very reason, we think consumers have a right to know and compare costs. We try to help them do that with support on our websites, but we also we would strongly recommend that also hospitals' transparent prices become available.
I would agree with you. I would also agree with what so many of my colleagues on a bipartisan basis have said about prior authorization. I mean, I know physicians personally who've spent hours on the phone debating and begging you guys to give them authorization. Just recently, I knew a patient who was 30 years old, had brain surgery, and had to be on, and when they went in and found that she needed 2 stents instead of 1 in her brain. They were on the phone for hours begging you all to let them keep her in the ICU overnight. So it's not really clear to me that we can bend the cost curve at all if some of the sacred cows that you all have are not just laid down to die. I thank you all for your patience. Thank you, Mr. Chairman, for your indulgence, and thank you for your patience here all day. We've kept you a long time. I yield back.